Hi, my name is Khalil Diab and I'm Clinical Associate Professor at the LAU School of Medicine, the Pulmonary Division. I will be talking to you today about a novel and new treatment for emphysema. What is emphysema? It is breakdown of the lungs from smoking. As you can see here, this is normal lung and this is damaged lung from smoking consistent with emphysema. This portion of the lung cannot be used. Oxygen comes to it and it cannot be diffused into the blood and therefore cannot be used and leads to shortness of breath. You can see here normal alveolar sacs, which are the sacs around the lungs that take the oxygen, and these are damaged ones consistent with emphysema. Sometimes when there's a lot of emphysema, what happens to the patient's lungs is they get hyperinflated or much bigger than normal lungs that we see over here. And this leads to a lot of stress on the breathing muscles, and the patient gets significantly shorter breath from this. And this is a CT scan, which gives us a much better view of the lungs than a chest X-ray. And you can see here the normal lung tissue, but you can see all the black lung tissue here, which is all broken down lungs that basically are not using any of the oxygen that comes to them and therefore leading to shortness of breath. Another example is this is a normal CAT scan of the chest. This is a CAT scan of the chest with emphysema, and you can see all the blackness over here and where the oxygen goes and cannot be used at all. Typically, how we treat emphysema is we tell the patient to stop smoking, to take their inhalers on a regular basis. But in a number of patients, despite all these treatments, they are still short of breath and their lungs are still very large. So how do we treat them? One of the novel ways is using something called endobronchial valves, which I will show you in just a bit. These are the endobronchial valves here, and we see two kinds of these valves. They are one-way valves that are inserted inside the patient's airway tubes, and they empty all the air out from the emphysematous areas of the lung or the damaged areas of the lung, and they don't let the air back in. So these damaged areas of the lung basically deflate and go away, and normal lung tissue takes their place and the patient breathes better afterwards. This is how the procedure is done. This is an emphysematous lung. A bronchoscope or a scope that goes into the lungs goes in and blocks the area where the emphysema is. And then based on the diameter of this balloon, certain size valves are placed in there to make the air leave the lung. And as you can see, after the valves were placed, the portion with emphysema of the lung is much smaller here, and therefore the patient probably is breathing better in this case. However, as we can see here, it's very important as we're doing this procedure to make sure the portions of the lungs in the patient are completely separated from each other, because in some patients, the fissure or the dividing line between the two lungs is open, and therefore you block the upper lung, but air from the lower lung goes up there and the procedure fails. So we always check with the radiologist first to make sure that this fissure or line between the two lungs is intact before we do the procedure. And because incomplete fissures are present in about 74, sometimes up to 74% of patients sometimes have incomplete fissures, and therefore the procedure fails in them. In conclusion, who is a candidate for endobronchial valves? It's patients with severe emphysema whose lungs are very large and still short of breath despite stopping smoking and taking their inhalers. What do we need before the procedure? We need to evaluate the patient in clinic, check their breathing tests or pulmonary function tests. We also need to get a specific high-resolution CAT scan of the chest to look closely at their lungs and then determine whether or not they will be candidates for the procedure.